Today, Ginger chats again with Lori D'Alessandro for part 2 of our series to demystify the therapy process. We'll break down modalities like CBT and EMDR and provide practical roadmaps for finding the right therapeutic fit. Please note that this episode is for educational purposes and is not suitable for professional medical advice or treatment. Let's get started.
Hi, I'm Addie Reinhardt.
And I'm Ginger Templeton.
We're both vets who stepped out of full-time clinical practice, but we're still deeply rooted in the profession.
And this is Out of Practice, a podcast where we talk honestly about life in and out of vet med.
This podcast is brought to you by MentorVet.
Hi, welcome back.
Hi.
So we are once again speaking with Lori D'Alessandro, and we're focusing on mental health professionals, and the veterinary profession. So Lori, reintroduce yourself, if you don't mind, to our listeners.
Okay. I'm Lori D'Alessandro. I am a licensed clinical social worker. I'm also getting a doctorate in psychology and counseling with a concentration in trauma. My dissertation is on resilience and mental well-being for veterinarians. And I'm excited to be here today. And I specialize in PTSD.
Yes, and we are excited, one, to have you here today, but also to have you in the profession. And I should probably pause and say this is Ginger. Addie is on vacation, and so I'm squeezing in some interviews right now while she's away. But Lori, Addie and I talk often about how important it is to have mental health professionals when we are having these conversations around well-being, burnout, mental health issues in the profession. Oftentimes, as a group, we tend to be kind of do it ourselves.
Yes.
General practice veterinarians have to wear a lot of hats, and I think we extend that over into human health care sometimes, and we forget that there are professionals who can help us. So thank you for focusing on the veterinary profession in your studies.
Oh, you're welcome. It's a big topic.
Can I ask, what was it about veterinary medicine that caught your attention?
Interesting story. When I was doing my master's degree, I wrote a paper on euthanasia and the impact on the pet owner. And that's when I found out about the impact on the veterinarian.
Yes.
And I was shocked, as most people are, when they find out about the suicide rate and the mental health, the state of mental health for the profession. And that's when I was like, why is no one doing anything about this? So that carried over. So I knew immediately going into my PhD, this is my topic. And we're going to focus on resilience, not what's wrong, but what could work, what can be implemented without putting the burden on the individual.
Yes.
Not saying everything has to be, well, it's your problem, you deal with it. What can we do from a systemic point of view too?
I love that. I hear the social worker in you, maybe a little bit of the macro and the micro.
Yes.
And I will say that this is something that Addie and I also talk a lot about. And in my role at Moves, oddly enough, as a COO of a company, I'm often thinking about what is the organizational piece, what is the individual piece with any problem. And I think with the profession, what is the professional piece, what is the industry piece, what is the individual piece. And so the word resilience, I think in some spaces has become a little bit of a dirty word because it implies, or maybe we infer, that we are supposed to be resilient despite the circumstances. So I love hearing you say that you're looking at it from a systemic level.
Absolutely.
As I experienced in our last call together, I already have 10 things I want to ask you about, and I have to focus because we said we were going to talk about treatment and, therapy and approaches. And in the last episode, we spent a lot of time on trauma.
Yes.
We spent a lot of time on, symptoms, the potential that individuals in our profession may be experiencing some PTSD related to the work itself.
Yes.
And also, the idea of big T, big trauma, what we might think about with a combat veteran, something like that, as well as little trauma, chronic childhood trauma, which might be a big T, might be a little t, and then professional experiences that can be traumatic and the cumulative stress and the impact of that. So if an individual is experiencing some of the symptoms and they're thinking, this something's not right, right? They're not going to diagnose themselves, but they're thinking something's not right. What is the hope? What is out there for them if they do, in fact, arrive at a diagnosis of PTSD or something adjacent?
Yes. There are many options. And what ideally, if a person came to me and said, as an individual, not as a therapist, but as an individual, and they said, I keep thinking about this thing over and over again, or I notice that they're having very strong reactions to things that are out of proportion to the experience. I would suggest that individual talk to someone, whether it's a counselor or a therapist or a psychologist. And what we would do is take a history from the person, because it's not always just the thing that you think it is, not just the one case, or it has something to do with my boss or being yelled at. It can tie to multiple things in our background. Like, for example, we'll usually have somebody do a trauma timeline, write a timeline of your life and everything, quote unquote, bad that stands out to you, put those in there so we can see. And quote unquote bad varies from person to person.
Right, right.
And that's why also when people are thinking, should I go see someone? Should I not go see someone? It's not that bad. Well,
yes,
the comparison is usually I'm comparing to a war veteran,
right.
veteran who went, in wartime, got super mentally, they had to kill people or something.
Right.
And they're thinking, well, I don't have trauma like that,
Right,
or I can
right.
sleep through the night most of the nights and,
Right.
I'm not that bad. But not that bad can turn into really bad.
Well, and I think as veterinarians, we can see this in our patients, right?
Yes.
So we can look at a
Yes.
creatinine and we can see that creatinine creeping up and it's not that bad. But we know if we intervene now, maybe the outcome's going to be better
Yes.
than if we wait until it's that bad. And I think
Exactly.
also this idea of competitive suffering. They have it worse. I have it worse. This is a waste of time and energy. What is impacting you? Is there something that can help you feel better or function better?
Right.
And, I don't think that hopefully anybody in the mental health profession is going to be judging you for coming in with a small problem versus, a problem that we see as legitimate.
Exactly. And that's your version of a small problem.
Yes, yes.
Your therapist or your counselor may say, yeah, that is pretty big. And
It's pretty big.
yeah, and they'll validate that for you. So you understand, that experience, it would impact anyone. So don't, and as I'm saying that, I'm thinking of the person that might be, well, I don't want to hear that it is a big deal.
Right.
And that's okay too. Just understanding that you don't get out of this life unscathed. Everybody has trauma. And whether it has to do with your job or your childhood or, something else that happened. Like, for example, recently there was ghosting was a thing. Your friend would just ghost you all of a sudden. I saw several kids because that is traumatizing.
Yes. Abandonment.
Exactly.
Yes.
And you have to talk to somebody. Again, going back to the, my definition of trauma, which is this doesn't happen why did this happen? It's not supposed to happen that way.
And the brain is trying to solve for this that does
Exactly.
not fit with the worldview. Okay, so the brain is stuck in this loop of rumination, heightened arousal, and I keep hearing you say you need to talk to somebody. And I can
Yes.
imagine
Yeah.
some of our listeners are going, but I don't want to talk about it.
Yeah.
But it's not as simple as just talking about it. So
Right.
walk us through what. And again, I probably should throw in a disclaimer, and I'm sure Addie or Jacob will do this at the beginning. This is not intended to treat or diagnose
Right.
or tell you what you need to go out and pursue. This is meant to educate about
Yes.
options and available things. So when we think about trauma and PTSD, what treatment modalities have results, and how might those look different than people expect?
Yes. So first, almost every therapist is going to start with cognitive behavioral therapy, which is we're going to identify the thoughts that you're having. But that doesn't necessarily mean you're going to have to talk or, and talk it to death, for example. We just need to know enough because there's therapy like EMDR, eye movement desensitization and reprocessing, which interestingly, you don't have to do the eye movement part.
Right. Right.
You just need bilateral stimulation of some sort, whether it's tapping, whether it's...
So let's pause. So EMDR is a form of treatment that can be
Yes.
administered by somebody who is licensed in EMDR. Is that correct?
Certified.
Or trained in it?
Mhm.
Certified. Okay. And so again, the word eye movement,
Desensitization
desensitization
and
process-
reprocessing.
and reprocessing. So the eye movement is side to side. So the idea is stimulating both sides of the brain.
Yes,
through
because
the process.
emotion side, logic side.
Right brain, left brain. So we've
Yes.
got, clinicians listening to this. We understand this sidedness of the brain. But then you said something, it doesn't have to be the eye movement.
Right.
But when it is, what would that look like? So somebody goes in, they have their history taken, their therapist says, you know what, EMDR is going to help you.
Yeah.
We're going to do EMDR. If they use the traditional light-based approach,
Yes.
this sounds crazy, right? This person is
Right.
listening going, what are you going to do with lights? Tell us.
Right. So typically there'll be a light bar. If you're in person, it's a light bar that's in front of you, and the lights are going like left, right, left, right.
And the eyes are following the light.
And eyes are following the light. I do an online version that looks like a little ping pong ball going back and forth on the screen.
Love it.
And when you're doing this, my very layman's explanation for it is we're taking your brain offline for a minute.
Mhm.
So you're not focused on the emotion or the story. You're telling the story. And this lets your brain unhook from that emotion that it has tied to the story and your normal reaction to it. So you're telling it, and this looking back and forth, or whether it's the sound back and forth, left, right, that's helping you reprocess by unhooking that emotion. And you don't even have to say the thing out loud.
Okay.
You can just be thinking, and the therapist will stop at any time if you're feeling overwhelmed. But we tell people it's like riding a train and you're just watching the scenery go by. You're going to either narrate what you're seeing and experiencing or did see and experience, or you're just going to think about it. With sometimes, if people are using sound or tapping, people will close their eyes and just watch it in their mind like a movie. And then, we pause at certain times. It's not like prescribed times, but, if I see that someone is getting really overwhelmed or emotional, I might ask them if they want to take a break. Usually they just want to plow through. And
I that sounds like veterinarians
yes,
and vet techs.
exactly.
Just push on through.
And then at the end, the most interesting thing happens is your brain can put the things together. The emotion goes down, the story's integrated with, now I understand why this happens or why these things could happen. Your brain offers up an explanation.
Now, I do want to be a little bit, I guess, pedantic or just granular. So when you say tapping, when you say sound, so an individual maybe close their eyes and there is a sound that is coming in through headphones,
Yes.
left, right, ping, ping. And same with tapping. You're tapping left, tapping right.
Yep.
I've heard of like handles that like vibrate hands
Tappers.
left, right,
Mhm.
tappers. Okay. So lots of ways to get this bilateral stimulation of the brain while the story is being told or visualized or considered.
Yes.
So this is not something that's really a gut-wrenching physical. Like this is just a pretty simple little exercise, it seems.
Yeah.
And yet the results are pretty positive. Do you have data?
Very positive. Good question.
I don't mean to put you on the spot,
Yeah.
but just this has been studied in other
Right.
areas of trauma.
Absolutely. And it's one of the treatments like the Veterans Administration uses, which when they have given their stamp on a
Yes,
treatment,
yes.
right. Because it used to be like narrative, narrative therapy, exposure therapy. Some of these have been found to be a little more hurtful than helpful. Like some people don't want to do narrative therapy. They don't want to talk about the whole thing. So that's why if you give me your background and you tell me, and this really bad thing happened and it has to do with work, but I don't want to talk about it. When we get to EMDR, you still don't have to tell me what the thing is.
Mm-hmm.
And we can start and go through it. But the thing I always tell people is EMDR is sort of like, again, layman's, opening Pandora's box. Your brain is going to pull out the filing cabinet of all the other things that reminded of that situation. And so if there are other things that are like that experience that we're reprocessing, they're going to come up too. We can try to stay in one lane in that thing, but a lot of times other things are going to be pulled in as well. Doesn't mean they're horrible things.
Sure.
It just means this is going to remind you of the time that Jimmy stole your lunchbox in third grade because it feels the same way.
Yeah.
And people would be sitting there and go, oh, yeah, this reminds me of da-da-da. And, my dad yelling at me or my teacher calling me out in class, and it was so embarrassing. But we're getting to the core thing.
Right.
That this emotion's tied to. So if you get upset every time your boss yells at you to a, very reasonable, it's not tied to, it's not proportionate to him yelling at you. When we do EMDR, you're probably going to pull up one of those things. Like, this is reminding me of my third grade teacher standing me up in front of class and making me explain something. But the great part is when we resolve that, you feel so much better. And now it will not bother you when you're, anybody yells at you. It's not going to bother you anymore.
And I think this is something for many of our listeners who have maybe tried a little therapy. We talked in the last episode about it being hard to find somebody who's a match. You really need to look for the right person. Maybe you tried somebody you met a couple of times, you did some CBT, or even you didn't get that far, you were just doing history taking and a little of the narrative piece. There are modalities like EMDR and others that are very specific and carry good outcomes. And I think knowing that might encourage people, to seek help when they realize there's something very
Absolutely.
tangible. I also want to touch on, you just talked about something I hear all the time. Your boss, quote unquote, yelled at you, and it triggers this disproportionate response. Now, as a leadership development coach and now in a leadership role, I get the opposite version of that story. I said something to my team, and they accused me of yelling at them. And I think for our leaders listening, hearing what Lori is saying, now this is not, we're not here to diagnose our team, right? We're not here to guess at trauma and whatnot, but having a bit of empathy and realizing if you're being told you're yelling and you're saying, I didn't even raise my voice, maybe what they're perceiving in part is coming from their own past or their own current stress or insecurities or what have you. And it's not about whether or not you yelled.
Yep.
It's not about how loud your voice was or even the tone, but it is about the dynamic between what they need in this moment in terms of feedback.
Yes.
And as a leader, what you're able to give, right? We aren't perfect either. And sometimes we do snap. Sometimes we do get a little huffy. I do it all the time, right? I am the least perfect. But just thinking through that context, and if you have somebody who's truly triggered in an extreme way, maybe sitting down and offering, not only empathy, but maybe some resources as well.
Absolutely. Yes. We don't want to do therapy at work, but it's,
No.
if they were open to maybe even asking what was it that was triggering to you in that situation? So if there is something that we could change, that we, validly could do it. But
Yeah.
But yes, we have to consider that people are laying on a lot of past experiences onto every experience, and bosses are a trigger because you represent every authority figure that they've ever had to deal with.
Yes. And I hear this, and I experience this occasionally, but I hear it often, which is I don't perceive myself in this boss role, in this leadership role, as being intimidating.
Mm-hmm.
And we forget it's the title and the power dynamic.
power.
Whether we like it or not,
Yes.
it is what it is. So we do, if we want to be effective leaders, we do have to account for some of this and be willing to adjust as we're able.
Yes.
Before we close, this has been fantastic. If somebody is listening and thinking, I need to find a therapist, I'm interested in EMDR, how do they get started looking for someone?
Yep. First, if you have insurance, look up who offers it under your plan. And you're going to be looking for a trauma-informed therapist and someone who does EMDR also.
So they'll list that usually on their profile.
They will.
Okay, so, we've talked about folks looking for support should they need it. I also want to always remind our listeners of the value that you bring by normalizing and validating mental health care. We talk about, I'm going to a doctor's appointment.
Yes.
Without oversharing, right? Without over-disclosing, just normalizing, that you benefited perhaps from therapy or you benefited from EMDR or something along those lines can go a long way for those around you. And I think especially in the stressful environments that we're working in and with the mental health stigma that we know historically at least has existed in the profession.
Yeah.
I want to encourage our listeners to be willing to speak up and
Absolutely.
advocate.
Yeah. And, you can think about it like a car, as if you were a car. You're going to go to a mechanic if you need a tune-up. So it's the same thing with mental health. Like, if you need to talk to someone, don't necessarily lump it into the category of there's something wrong with me. It's no, you just need to talk to someone. That doesn't mean there's anything wrong with you.
Yeah, we're maintaining our brain health.
Yes, you're just doing a tune-up. We're just, checking to make sure everything's running smoothly.
I love it. Well, on that note, Lori, I want to thank you for both of these episodes. I think we could truly have you on, and probably will continue to ask you to join as a guest from time to time. Is there anything that our listeners should know about you or where to find you if Jacob can cut this if that's not a relevant thing, but do you have a social media presence?
Yes. So it's Lori D'Alessandro, LCSW, but Lori _D'Alessandro, LCSW. You can find it. Just look up Lori D'Alessandro. It will come up.
We'll put it in the show notes.
Yes, exactly. And then you can always DM me. I can help you with, if you are looking for a good therapist in your area, I can absolutely help you find that as well. So
fantastic. And we will be eagerly awaiting your research results and, more of what's coming from your graduate studies. And you are actively involved with Mentor Vet as well. So folks who are in Mentor Vet programs will see you there and maybe, be able to benefit from some of your knowledge on that side.
Yes, absolutely. And if you ever have any ideas for articles that you'd like to see or me to address anything in a video, feel free to message me about that as well, because I'm always looking for more ideas.
Wonderful. Well, thank you again. We appreciate you, and I'm sure our audience has learned a lot today.
Thank you.